Bruce, and thank everybody for coming. And actually, the Global Health Initiative and John is one of our partners on the Myanmar project for having us speak tonight. I'm going to have some notes here because 5 minutes goes fast. And if I start talking about something that we've been doing for 5 years, I'll never get to what I'm supposed to get to. So basically, I've been in neurosurgery at Ford since 1986. Started with FINES, which is an international education society in neurosurgery, in 2004, going to places for 2 weeks at a time each year. The chairman of neurosurgery at the time, not thrilled that I would disappear for 2 or 3 weeks at a time to do something that wasn't Henry Ford related, Dr. Rosenblum. But at some point, it seemed, after doing this for about 8 years, that it would be nice to be in one place, and maybe you could do something more effective by being in one place. But some of what we ran into at going to the different places, at the time it wasn't we, it was me, much to my wife's chagrin most of the time. But I would go, and a lot of the practitioners were more interested in their private practice, so they'd spend about 3 hours at the hospital, which was usually a government-funded hospital, and then they disappear. So when I was in Addis Ababa one year, I was there for a week, 2 weeks, and in that 2-week period, we did 6 operations because the anesthesiologists, the surgeons, always found a reason, it seemed, to not do the surgery. So really, unfortunately, we had a list of 40 people with brain tumors for surgery the day I arrived there, and when we finished, we had done 6 operations 2 weeks later, and 12 of those patients were now off the list because they had died. So this is not really much different than most of the developing world locations where medicine is provided, especially neurosurgery. So once I got to Myanmar, I spent 2 years back and forth, but the people there were dedicated. The government doesn't allow them to leave the hospital, the government hospital, until 4 in the afternoon. So they can't run out at 8 in the morning and go to their clinics and find reasons not to take care of the patients, who are all provided care-free. Most of their families stay in the monasteries in town in Yangon, which is formerly known as Rangoon. Everybody remembers it from all those movies with Yul Brynner. but in any case, they're very dedicated. And so it's based on that it seemed like a good thing to do, to stay in one place. I had gone to Southeast Asia to about 5 different countries. I generally really enjoy being in Southeast Asia. Just the population is different. It's just, they're comfortable in their own, I don't want to use this word in a bad way, but in their own sort of what we would consider poverty. They have an optimistic way of looking at things. And so it was really interesting in the countries there. 6 neurosurgeons when I was there in 2012. This is the year after Hillary Clinton and Barack Obama first went and recognized Myanmar again, formerly known as Burma. And so 6 neurosurgeons, 60 million people. Now, they're not all showing up in the cities because they can't get to the cities. You have to sell your family's house and everything else to be able to afford to go to a city half the time for many of the people that live in the provinces. Northern province, the one everybody hears about, that Rakhine province, where there's so much strife between what you call this oxymoron, the militant Buddhists and the Muslim community that's right on the border of Bangladesh. That's the northern area, quite far away from where we were. Well, let me get back to the point. This is why I need this thing here. Okay, so when I went there was one neurosurgery resident, because it took 3 to 4 years of general surgery. So Dr. Myang, who's the head of one of the program directors, asked that we write a letter for them to the Ministry of Health describing what it's like in the United States and why they don't need 4 years of general surgery, which totally disrupts any interest in going into neurosurgery because it takes too long to get there, and they're young people, they have families, they're done with their training, they want to start earning a living. And so about 2 years later, well, the long and short of it is, 2 residents at the beginning in 2012, now 35 residents. Sometimes even I'm puzzled by that, but in any case, I don't know what the selection process is or whatever, but at least there's that much interest, and you can foresee at some point that you graduate enough people at a reasonable level, and then you can start putting people out in the community, which would be one of our longer term goals with the project, and that's to work through the Ministry of Health to provide support, neurosurgical support, in the communities, not Yangon, not Mandalay, the two main cities in the country. Let me see here. When I went there were procedures that nobody did there. When we went there, I did it for 2 years individually. Then I brought a team. John came with us. John's actually how we got hooked up with the Ministry of Health and how the research aspects of this program may take off at some point in the near future. I go there as a surgeon. I think surgery. I don't think about anything else really. And so having John around is, tremendous help for the whole program, and actually made it turn into a program instead of just another, what my wife says, a vacation for me and not for her. So we have introduced a number of procedures that we do all the time at Ford Hospital, patients for brain tumor surgery with awake surgery, endoscopy, which is a common, easy thing to do. Many of the patients there, young children who have hydrocephalus, a condition where there's a blockage of flow of fluid, cerebrospinal fluid out of the brain, they don't even have the shunt systems there. So what do? They take an IV tubing, if you know what an IV tubing is, what goes in your arm when you go into the emergency room or something. And that tubing is connected from the brain to the abdomen, which is, I can't say it's barbaric, but it's a pretty crazy way to treat a condition. But they'd had no funding. The government was totally military from about 1959 until 2011. And they just weren't interested in outside help, weren't interested in outside support. So since going, and I don't think it's our teams going, there's other groups that do go to Myanmar from the UK, from Switzerland, from Japan. And since they've opened up and some of the military people have taken off their uniforms and put on the suits, so now it's sort of not quite military government, but since Aung San Suu Kyi, the Nobel laureate, since she's been in charge, it's moving a little bit more towards democracy. Democracy doesn't evolve very quickly, as we all know. So, what impact have we had so far? We've taught them a bunch of procedures that they didn't do before, some of which they even use frequently now. We've started a program where their residents actually come to Henry Ford Hospital, 2 of them each year. Well, not each year, this is the first year. And they came back in, when was it? May and June. After doing that, we went back in November. Now they have about 15 residents who want to come. Of course, it's not super expensive, but it's not inexpensive to bring them. It takes a lot of work on the part of my own residents and part of the team and John's Global Health folks here that all were kind enough to take them to the auto race in June over there on Belle Isle, and somebody down to Eastern Market. And and their main concern when they left was, gee, we would like to have more free time so we could go. And I keep reminding them, this is really primarily neurosurgery, right? So now they would like their nurses to come. And when, and they're interested in having that. We take Tracy Enos is our head nurse in the OR, Andy Steiner, who works for one of our folks in the back today at World Health. I can remember the name of the place exactly. It's World Medical Relief. And so Andy works there, and Andy's a biomed engineer. And so with the team, we can go there. Andy busies himself going in the closets and bringing out equipment that should have been used again, but isn't because nobody knows how to fix it there. So he starts fixing things. They'd like to bring some biomed people there. So I'm sure I'm up to 6 minutes. Okay? Okay. Paranoid. Okay, so we take the team, and having the team go it's more fun for me, for sure, but it also provides a lot more for them. They get to see a lot more. Their nurses get to see how Tracy runs the operating room in terms of how does she just know the equipment for all the stuff that we use on the procedures. Andy's able to bail us out on that awake craniotomy we taught him about 2 years ago. About a third of the way into the procedure, one of the anesthesiologists says, machine not working. And that generally means you stop. So I looked at Andy, and Andy looked at me, and so Andy heads over to the machine, and about a minute later, it's working. And so there's a big, big plus when you go to these international programs to have people who actually know how to do the technical stuff of that program. So The latest thing we're doing is we've started, what I noticed the most about the quote training in Myanmar and every other place I've been, about 10 other places in Africa and in Southeast Asia, is there's a training, but it's an apprenticeship. So if you go in and see a physician here at Ford, somebody's going to spend some time talking to you, doing an exam, looking at x-rays. That's not the way it is in Myanmar. In Myanmar, the first day we get there, we see maybe 30 patients in the morning. We're sitting there, John's sitting there, we're all sitting there, and the x-ray's put up on the board. We look at the x-ray, the patient sits there very quietly, head down usually, and we decide if something can be done. I ask the resident, what is their exam? And they look back at me like, what do you mean? What's the exam? Nobody knows how to do a neurologic exam there with any consistent method. So that they'll look at an x-ray and think this is the problem, but they don't try to correlate it to the patient's symptoms. They just look at an x-ray. And so there's a ton of surgery that's done that's really not even on target. So when they come here, we set them up to learn how to do the neurologic exam. Next month, we're going to do a trip down there where we teach. I'll tell you about that in a second. So we basically teach them how to do the neurologic exam. Probably the most significant thing on a resident level to teach them, because it takes years to learn how to do what you have to do surgically, but it takes you 3 hours to learn how to do a neurologic exam and save a ton of people unnecessary surgery, and also do the right surgery for the rest of them if they need surgery at all. So the next thing, the last thing that's coming up is next month, we're actually doing a boot camp. And in this country, every neurosurgery resident for first year and second year has to go to what's called a boot camp. It's a 2-day intense course on how you do all the procedures you're going to come across in the next 5 years. Not the sophisticated things, but the simple parts of them. So what we've put together is a program where we have residents from It's Vietnam, Thailand, Cambodia, Nepal, and Singapore, and the 30 residents from Myanmar coming. We've got about 21 international staff, and we're going to do a boot camp. I hope it works out. I mean, we're running a very tight, ambitious schedule, but they are desperately wanted there. The people in Myanmar love it because it sort of puts them in the map at Southeast Asia. The Myanmar neurosurgeons are really high quality, high integrity practitioners. So for them to become sort of a role model program would be a good thing for Southeast Asia. So I think in the long run, that'll be an excellent part of it. Another part is the research. We haven't quite been able to get that off the ground yet, although we've been trying, Dana and John. But it's a little difficult because email's not really that well received in Myanmar yet. When I was there 3 years ago, you could barely work the emails. I mean, it just was never workable. So now it is. I think that we'll see how this boot camp goes. The companies that are supporting it, Medtronic, Integra, and Storz, are doing everything. We're not charging anybody any money to go to the boot camp, and Medtronic's even paying for, I think it's 14 people from outside of Myanmar to come to the boot camp. So we'll see how that goes, and my guess is they're going to want to do it over again. I mean, it's a ton of work for us, but it's worth it. So basically the overall thing when we started was have fun going to an international place that's new, we can see the culture from the inside, and now it's evolved into actually, in large part because of the GHI input, because if it was just me, what can you do as one person? You can do a little, you can treat one person at a time, but when you involve everybody else, there's so much, it's such a broader scope that's presentable. And you actually have a team. I mean, when they come, Dana's helping us arrange things. Tyler's coming with us to Myanmar so he can be the guy who fixes the computer when it goes down in the middle of the lecture, right? So that's really the program. It's been going, it's really turned into a program about really 2.5, 3 years ago. We've had some really generous support from a few people here in Detroit that will keep it going for another 5 years. And basically, it's fun, and it has some potential. So I think that's all I really want to say.